Consideration of memorials. Mr. Carpenter, would you please read the title of the Senate Joint Memorial 3?
Senate Joint Memorial 3 by Senator Garcia and Representatives Covarrubias and Escar concerning memorializing Congress to approve and fund a new Veterans Administration hospital in southern Colorado.
Senator Garcia.
Thank you, Mr. President. I move Senate Joint Memorial 3 and ask to be read at length.
Mr. Carpenter.
Senate Joint Memorial 3 by Senator Garcia and Representatives Covarrubias and Escar concerning memorializing Congress to approve and fund a new Veterans Administration hospital in southern Colorado. Whereas the Veterans Administration, VA, healthcare system is an invaluable resource for the millions of men and women who have served their country in the United States Armed Forces and for their families. And whereas southern Colorado has the fastest growing population of veterans in the nation, with more than 86,000 men and women in the immediate vicinity eligible for VA care. And whereas the current VA satellite facilities in the area only have the capacity to serve fewer than half of the eligible veterans who may need care. And whereas, since the closure of the VA facility in Bent, Colorado in 2001, veterans in southern Colorado and elsewhere in the region have been forced to travel to Denver or the Fitzsimmons VA Hospital in Aurora for specialty care. And whereas, when a patient eligible for VA care must travel more than 50 miles for treatment, taxpayers, in addition to the individual veterans, are responsible for travel and lodging expenses for that patient. Further, many elderly or otherwise infirm veterans have great difficulty making often frequent trips to the Denver metropolitan area to receive their health care services. And whereas many veterans eligible for VA care are mid to low income residents of the state and may be surviving check to check off of retirement, pensions, or Social Security payments. And whereas construction of a new VA hospital in an area north of Pueblo would serve the veterans of Pueblo, the home of heroes and birthplace of 4 Congressional Medal of Honor recipients, in addition to residents of Colorado Springs and El Paso County within its 50-mile service radius. Those men and women living as far as Castle Rock and Trinidad would be eligible to receive VA healthcare services without requiring taxpayer assistance for travel and lodging. And whereas, in such a location, a new VA hospital would be positioned to serve not only Colorado veterans, but also veterans in western Kansas and Oklahoma and northern New Mexico, for whom travel to Pueblo would be closer or more convenient than travel to Albuquerque or another regional facility. And whereas, a new VA hospital facility north of Pueblo would be a major economic driver and boost to rural health care in the state by drawing hundreds of doctors in residency, nurses, and other healthcare professionals to underserved areas of Colorado. And whereas, these new healthcare professionals could partner with local hospitals, healthcare facilities, Pueblo Community College, and Colorado State University, Pueblo, to increase access to valuable medical and mental health care and specialty services for the general population of the region, in addition to those veterans being served by the VA. And whereas the Veterans Health Administration Office of Rural Health works to implement targeted solution-driven approaches that increase access to health care for the more than 3 million veterans nationally who live in rural communities through innovation, collaboration, and partnership with VA program offices and federal, state, and local healthcare entities. And whereas, in such respects, a new VA hospital in southern Colorado, north of Pueblo, would contribute significantly to improvements in the quality of life and health in the state and region. Now, therefore, be it resolved by the Senate of the 71st General Assembly of the State of Colorado, the House of Representatives concurring herein, that we, the members of the Colorado General Assembly, call on the congressional leadership of our state and nation to actively and aggressively pursue funding for the construction of a new Veterans Administration hospital to be located in southern Colorado, near Interstate 25, north of Pueblo. Be it further resolved that copies of this joint memorial be sent to Colorado's congressional delegation, the president of AFGE Local 2430, the director of the VA Eastern Colorado Healthcare System, and the United Veterans Committee of Colorado.
Senator Garcia.
Thank you, Mr. President. Members, thank you for your support. I hope, if you look at the co-sponsorship on this memorial, to continue to move forward. I think it's a robust conversation that we're willing to engage in southern Colorado, recognizing the needs of our veterans. I served in the United States Marine Corps as a mortuary first specialist in 2003, and can tell you that in southern Colorado, we recognize the need for additional services on behalf of our veterans. You know, I reminded several people that often we say it's important to recognize the the tasks and the commitment that veterans make and how much we support them. But this resolution really sends a message that is important, that this body recognizes that support and looks forward to exploring the opportunity that Southern Colorado awaits.
Senator Hill.
Thank you, Mr. President. Colleagues, I want to ask for your support for this memorial as well. I appreciate the senator from Pueblo bringing it up. And there's a theme in our country right now. There's a theme in our state. It's the challenges as we see demographics, more and more folks moving to urban areas, more concentrated populations. What does government look like in bridging the needs of urban areas versus rural areas? And I think this discussion of a VA brings up a huge opportunity. We know there's need for reform. We ran a joint memorial together last year for reform of the VA, to rethink how we're providing services to our veterans, to cut down the wait lines, to provide better access to those who need it. No one has a greater problem with access right now in Colorado than those that would be affected by this VA. Those in the South, those in the East, especially in Colorado. And when you think VA and we think our request, I think even beyond that, our request to Congress and to the VA administration is, don't just think about how we've done things in the past. Don't just do one more of the same messed up model. How do we innovate? How do we provide a new model of service? How do we provide better access that fits, especially in this largely rural area, very spread out? How do we provide the innovation and the opportunity to make good on our promises? For better or for worse, we made strong promises to those who risked their life, who risked their limbs, many of them missing limbs these days, my father-in-law included. We see this, we see a visible representation of their service, and it's important for us to make sure we give them the best care possible. I think this is a great opportunity for us to come together, left and right, Republican, Democrat, rural, urban, and say, let's do this, let's serve Colorado's needs, and let's do so in an innovative way that abandons some of the failed policies in the past, but really provides the access and the care and the opportunity to make good on our promise to those who have given so much to us. So I genuinely ask for your support, colleagues, for this important step forward in access for our veterans.
Senator Lambert.
Thank you, Mr. President. I just wanted to explain my no vote on this today. I strongly support the sponsors' objectives in doing this, and I strongly support the senator from Colorado Springs and his comments about the necessary reforms that we need to have in the Veterans Administration. And this year, I think for the first time in an awfully long time, some of the leadership within the Veterans Administration is actually being held accountable for their incompetent acts in their leadership within the Veterans Administration. The fact that we have had hundreds of thousands of veterans who have died waiting even to be enrolled to get their veterans benefits is an absolute disgrace nationally for this country. That's not this memorial. We have had cost overruns on veterans facilities that are basically robbing from the services that should be provided and are going into cost overruns and delays and things like that. Again, that's not this memorial. We've had a new veterans clinic in Colorado Springs, which is experiencing some of the same problems here. If you'll see on page 2, it says people elsewhere in the region, veterans have been forced to travel to Denver, the Fitzsimmons VA Hospital, for specialty care. And that includes the clinic in Colorado Springs because it's not providing comprehensive care. It's expected that veterans are going to have to go to a major hospital to have access to that specialty care. But that's not this memorial. My concern here is we are still following, our conclusion in this whole thing is we need a new veterans hospital in southern Colorado, which would solve some of the problems. Unfortunately, it doesn't solve all the problems. And I agree with Senator from Colorado Springs, who's saying we need fundamental reform in the Veterans Administration. I agree with that. And my vote is largely symbolic because I really, really support the objectives of what this is trying to do. We need to fix our veterans care system. And Congress is trying to come up with some new innovative ideas for doing that. But that's not this memorial. If this had sort of repeated the memorial from last year and said, let's fix the darn system, then I'm all in favor of it. But I don't think it's wise to telegraph the idea that in order to fix this, we have to have a same kind of veterans hospital, the same kind of business model that has been failing for probably 50 years. We need to fix the Veterans Administration from the inside. So I thank you, Mr. President, for the time. Again, I strongly support our veterans in this. I'm not so sure right now I can come to the same conclusion that the way we do that is to start a new hospital. It's not a matter, and I love having something right between the cities of Pueblo and Colorado Springs. That'd be a wonderful idea. But I'm very concerned that we need to have better access even through private care facilities, even allowing people in Trinidad, in Durango, in Grand Junction, in Burlington, to be able, if they're veterans, why cannot they get specialty care or local care from their local physicians in some of those areas if it's available, rather than forcing veterans going to specialty hospitals? And then it also includes, in some cases, having to go to Cheyenne, Wyoming for certain kinds of care. The distribution, the access to care in the VA has just not, they have not been listening to the concerns of the veterans in all cases. And I think we need to have that kind of discussion as well, because there are positive things we can do. But I thank the sponsor for bringing this forward, and I just want to explain my no vote. Thank you.
Senator Sonnenberg.
Thank you, Mr. President. I'd like to echo a little bit on what the good senator from Colorado Springs was talking about, although I'm going to support the memorial because his heart's in the right place. When it comes to reform, it makes more sense to me to hand out credit cards to each and every one of our veterans so they can get the health care any cotton picking place they want. They can go to their local hospital. They can go to any hospital in Denver, Pueblo, Durango, and we should pay for that. To me, that makes more sense than trying to fix a much broken system with overruns that they can't control. I want to hand my friends a credit card and say, we'll take care of you. Thank you for protecting us. We're going to give you a credit card. You get health care wherever you need. I prefer that avenue, but I'll still support the memorial because his heart's in the right place. Ask for you to consider those things in the future as well as we move forward on how do we actually reform this system and take care of those that have made it so easy for us to do what we do here.
Senator Neville.
Thank you, Mr. President. Colleagues, I appreciate the last two speakers on this. I do support what the sponsor is trying to do. We take a look at what we're trying to do with a system that has failed in delivery of VA services to our veterans. And then we talk about supporting another hospital. I support the idea of making sure that we deliver those services, but I do, to the senator from Sterling, I do agree with him completely that this is a failed system that is in need of a major overhaul. I do take one, even though I will be supporting this, this memorial, I do take one issue. When we start talking about economic drivers to areas and we start talking about truly what this should be about, is delivering services to our veterans, I would just encourage us in the future that we separate those two issues to make sure that we focus on what is truly important. I have a little frustration with that, and I apologize if that upsets anyone, but I think those are two separate issues and they should not be blended together. This is not about making sure that we're creating economic development opportunities for areas. This is about taking care of our veterans. So although I will be in support of the memorial from the good senator from Pueblo, I do take exception with some of the issues brought up within and encourage that we take a look at a system in the future that does not fail our veterans, that truly becomes innovative. The VA system currently, as it's formulated, is not that system.
Senator Koufalos.
Thank you, Mr. President. Good morning, colleagues. I rise in support of Senate Joint Memorial 003, and I appreciate the comments that have been made about the critical need for reform of the VA, and I agree with those comments. My purpose in coming before you is just to say, for the record, should the Congress approve and fund a new Veterans Administration hospital in southern Colorado, and should some type of construction take place down the road, that construction and the completion of that project be done on time and under budget, because we don't have a very good track record in the state of Colorado. I think that the final point I wish to make is that when we are talking about the need for an inpatient facility in southern Colorado, it does not necessarily have to be a massive hospital. There are very innovative and creative designs for hospitals that can meet the needs of an area, of a region, and I think that kind of creativity and innovation needs to occur should something like this materialize in the future. Thank you.
Senator Donovan.
Thank you, Mr. President. I rise in support today of Senate Joint Memorial 003 just because it's impactful to my district. Certainly, this hospital would be located in Pueblo, which is one of the central gathering places of southern Colorado, and where, as the memorial points to, we're seeing one of the fastest growing populations of veterans. But if you are a veteran who served our country and have an expectation of having access to health care throughout your life, and you've chosen Salida as your hometown, drive to Grand Junction is 3.5 hours. A drive to Denver pushes on 3. It's about 2 hours, 45 minutes. But Pueblo would cut down that drive to under 2 hours. This would be a more accessible hospital to the citizens of Salida and Chaffee County, and very likely Gunnison as well, depending on if it's snow or if it's winter or summer and what passes are open. So I rise in strong support of this. It would be great to have another hospital accessible to the south central and southeastern part of the state. It would certainly make access to health care more accessible for our veterans that live in those areas. So thank you to the sponsor for bringing this.
Senator Garcia.
Thank you, Mr. President. Members, I appreciate your thoughtfulness in consideration of this memorial, and would say that nothing precludes this body from being receptive to the suggestions that were raised. And I agree with the senator from El Paso County who recognizes that I think we should call on our VA system to be more innovative and more responsive to our veterans. I think we are united in the call that we recognize that more should be done for our veterans in the commitment that we make to them to serve on behalf of this nation, to ensure that they have the support that they have. So with that, Mr. President, I renew my motion for Senate Bill, for Joint Memorial 3.
Senator Crowder.
Thank you for the, I didn't mean to interrupt. You know, I think we have made some, you know, since I've been elected, this is the third secretary of the VA that indicated that they would fix the problems, and we haven't fixed them, but we have made headway. You know, a lot of what we're talking about, there's a lot of issues in what we're talking about. You know, TRICARE is available to civilian hospitals. But right now, the veteran also, through Connect, is also through a contractor through the VA. Matter of fact, the biggest problem we have with this whole situation, there's a lot of legislators who are veterans, but there's very few of us who are in the system and do not quite understand. And that's the biggest problem of, the hospital and the clinics are two different areas. Now, what I do advocate, what we have in this country, if you look at our healthcare system, the turmoil that we're going through there, as far as the clinics, the VA, I advocate those clinics be shut down. And I advocate that the civilian population or the civilian doctors take care of that. And I don't think there'd be a job loss, because I think the people that work in these clinics could actually transfer right into the healthcare system. But your hospitals are a different issue. But I think what we need to look at, specifically in Pueblo, we have 2 hospitals right now, and I think what I would like to see, and I did put on as a co-sponsor this particular bill, but what I'd like to see is a combination VA and civilian hospital. What we have is 2 hospitals that are somewhat aged. I think a single complex, if feasible, would be more of the way that we look at in the future. So I think one of the bigger problems I have is 70% of the doctors are trained in the VA system. And I will say that, that might be admirable, but the reality is I'd like to see these doctors practice on the civilian population if they want to get their credentials and whatnot, and send the VA the very qualified doctors. So there's a lot of issues, but we are making some headway. But and it's a slow process. But the reality is the VA is so big and cumbersome. But I don't think that the override and the cost or the issue on what we're talking about here. This is a wish list for a hospital of the future. And for that, I do support this and move this bill forward. Thank you, Mr. President.
Senator Garcia.
Thank you, Mr. President. With all due respect to the senator from Alamosa, I think we could ask for both. I think veterans deserve that. I think I would not advocate for the closure of any clinics that serve our veterans. I think members make a great point in saying that maybe there should be other options. The great senator from Sterling relying on saying maybe that we should be looking to support our veterans in any of those options. I think the CHOICE program does that, and I think veterans should have that kind of flexibility. But the reality is the services just aren't provided, and especially in rural Colorado where there's a lack of providers many times. A hospital can serve as an anchor for those services. And so I renew my motion for Senate Joint Memorial 03 and ask for your aye vote.
Is there any further discussion? Seeing none, the motion before the body is the adoption of Senate Joint Memorial 3. Are there any no votes? Senator Lambert. With 33 ayes, 1 no, 0 absent, 1 excused, Senate Joint Memorial 3 is adopted. Co-sponsors: Senator Merrifield, Senator Todd, Senator Williams, Senator Court, Leader Guzman, Senator Donovan,